And we are excited. We're about to introduce you to one of my favoriteest people in the whole wide world. I call him the godfather of Zeolite. He's actually the guy that put this not only this product, but literally the idea. He brought the product to the table, made it so that your body could use clinoptilolite, and made it into Cell Defender so that your body would have the cellular defense at the level it needs to engage with disease, discomfort, and despair. I don't think it gets any better than that. And if he's the godfather, that makes me the grandmother of all of this. And I am so, so happy. So with that, let me say, here's Rick Deitch, the biochemist that literally has been blessed with the ability to find and deliver products that change and bless our lives every day. Hi, Rick.
Hi, Marcy. Always a pleasure.
Always wonderful. Rick, I'm just going to turn you loose and say, let you take on the challenges of telling us a little bit about what you want to discuss with us today. And then we're going to open it up to questions. So this time is yours, and I'm not even going to take the hunk out of it.
Well, I'm excited to be here again, but are we, I thought we were just going to answer questions in this segment. So did you want me to?
I just thought you might want to start off with what you were finishing with a while ago when we were talking.
Sure. Yeah, but you said it. I'm the category creator of Zeolite for detoxification. It's certainly colloidal suspension of Zeolite for detoxification. The Zeolite products that were in the market before me were principally kitty litter, animal feed, air purifiers. There was a product that eventually became something called Quick Clot to clot blood. And then in Europe, they had Megamins, which was a detoxification vitamin in a capsule. And in Cuba, they had something called Estefan, which was for diarrhea. You took 6 zeolite capsules, and zeolite's so hygroscopic, it sucks up all the fluid, that it would be used for the treatment of diarrhea. So that was basically what was around before we came up with our first colloidal suspension of zeolite for detoxification. Now, of course, that was in 2004, 2005. By 2007, there were about 30 products on the market that were all kind of trying to knock me off. And most of them disappeared over time. But it is funny, though, because when I stopped producing my zeolite in 2012, a lot of that stuff went away. It got kind of quiet out there. And then in 2020, when I started producing it again, all these companies showed up out of the blue, like they were hiding. And it's almost like, and I've said this before, it's like there would be no Joker if there wasn't a Batman, So I show up with my stuff, and then everybody's out there now. Okay, Rick is creating the market again. Let's try to take that market. Let's say we're better than Rick and try to take the market. And most of them were people that either worked with my product in the past or worked with different distributors of my products in the past. But we've already gone over like why these are low-level knockoff competitors. Nobody knows how I micronize my zeolite. Nobody knows how I do my activation process. It is a labor-intensive process to get the product that is Cell Defender. And it is a trade secret that I've defended in federal court. So I had a federal judge in 2018 basically say that I have a defensible, valuable trade secret. And that allowed me to actually get a restraining order, a temporary restraining order against another company that was supposedly using my intellectual property. So nobody else has anything like that. Now, there's one company that says they have a patent. The patent itself is ridiculous. But people say, why didn't I patent my stuff? And the problem is when you have a patent, you're teaching the world how to do something. In fact, that's what a patent is. A patent is a contract with the public that says, I'm going to teach you my stuff, but I get exclusive rights to it for 20 years. That's what a patent is. The problem is once you teach someone something, they can steal it. They make a few tweaks to it and they say, I'm not infringing, so it becomes very easy to steal stuff once you have a patent. And of course, you also lose the rights after 20 years. It comes off patent. With a trade secret, you never lose that. Coca-Cola is not patented. It's a trade secret. You know, it's been around for over 100 years because it's a trade secret. They
That's
didn't
right.
patent it. The other thing too is that just because something is a patent doesn't mean it means anything or it's valuable. So I was sued years ago for patent infringement, something that was absolutely ridiculous. We actually had the patent invalidated at the time. I hired Harvey Manback, who was the head of the Patent and Trademark Office at the time, as my expert. Uh, but I said how ridiculous the patent was, and he said, the guy that used to be the head of the U.S. Patent and Trademark Office, that just because it's ridiculous doesn't mean it's not patentable. And as an example, he brought up a few patents. Like there's an issued US patent for the proper way to match your tie to your shoes. There's an issued United States patent. Okay. There's another issued United States patent on how to hydrate the Sahara Desert to make it arable farmland. And it talks about if you roll a snowball at the North Pole just right, and you take into account the Coriolis effect of the spinning Earth, the snowball will go around and around and around, picking up snow and ice, getting bigger and bigger. And if you did it just right, it'll land in the Sahara Desert, where it will melt and hydrate the Sahara Desert, which would turn into farmland. That is an issued U.S. patent. So
Right.
just,
And here's the
just
tragedy
because
of that, Rick. Somebody could actually come up with something that would aerate the desert, and they would have to pay somebody for that ridiculous patent.
if it worked.
Yeah, right.
My point is just because it says, so someone goes, I have a patent. Well, just because you have a patent doesn't mean anything. There's lots of ridiculous patents out there. You know, my company, we have 21 patents. I like to say none of them are ridiculous. But just because the one guy that's talking out there, the guy that has the soluble zeolite fragments, he claims he's got a patent on soluble zeolite, and the patent is ridiculous. But just because he has a patent doesn't mean anything.
Right.
Okay. So with that, I'd love to take questions. Does anyone have any questions?
So Rick, just before you do that, I just want to let everybody know that when you did have that first issue, and we were prospected by that particular company, but they were foolish enough to send me the biography or the supposedly record of this individual. And, you know, he was claiming 5 PhDs and all these other things. And literally, I researched that. I have all the data on this guy. Total fraud. I have actually his transcripts to prove that. But my point is, he created 2 of those supposedly zeolites for 2 different companies and made these ridiculous claims that you're talking about. So be assured, Rick is the real deal.
Thank you, Howard. Yeah, Howard started digging away, and it's kind of funny because even some of the degrees he claimed to have from the universities, that those universities didn't even offer that course of study or those degrees that he claimed to have. So it was a pretty easy check at some point that he did not have 5 PhDs, and then at some point you realize someone's lying to you when they say that they have a secret, they work for the CIA, so they have secret clearance, and that's why you can't find my background, because it's hidden, because I work for the CIA. And he also said he was a shaman, right? He's like an Indian shaman. I mean, at some point you have to just kind of, you know.
Plus, he was like 35 years old. How do you get 16 degrees before you're 35 years old?
Yeah.
Yeah.
I probably could have done it if I really focused, but I
You
was
probably
busy.
could have, but then you're you. And we
And
would
Rick,
have been able to see those degrees because you would have had them, not talked about them.
I just had a testimonial. I wanted to get this started. And guys, if you have questions, you can type them in the chat. And if you don't know how to do that, you can raise your hand and we'll take questions for Rick. So you guys got the next few minutes to have Rick answer some questions for you. But just had a testimonial from a young mother who's going to be on next week with a child who's had was actually without oxygen for 9 minutes after birth.
Wow.
And has some brain issues. doesn't speak well, does some la 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 things. And actually, so we'll have to pass that to you. It's gonna be a wonderful, only been on the product a week, and having some joyous la 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 that has never happened before, things like that. But she's excited and we've got hope, right? Tell us a little bit about, and I know we have Trisha's wonderful testimonial with CP and how she's recovered and gotten a quality of life. Tell us a little bit of how you look at the science of Cell Defender and possibly our other products, because I know some of the other products are working too, but especially the Cell Defender.
They're all working.
Yeah, they're all working. All of our products are working, but I mean, this specific issue, what do you see? I mean, give us a little bit of feedback on that. Why Cell Defender would help this type of person from a scientific perspective.
So yeah, if you look at autism spectral disorder, going all the way back to the 70s, they found out that chelation therapy seemed to help. And it was a very random event. There was a kid that had been eating lead paint. And for those who don't know, lead paint was outlawed in the United States in 1977, but there's still lots of old houses that still have lead paint. And the reason kids eat lead paint chips is they actually taste good. They're sweet. So when a kid gets a little piece of lead paint and he tastes it, he wants more. And so the kids eat the lead paint and it's really bad for them. And of course, lead is a toxic heavy metal. This one kid was autistic and he was eating the lead paint. So they took him in for chelation therapy to get rid of the lead. And he had all this kind of return of function. He had all these benefits. So these first publications were like 1977, 1978, when they started saying there's something about heavy metal toxicity and autism spectral disorder. Back then they just called it autism. But we know that there's a lot of metalloenzymes and metalloproteins in the body where heavy metals interact or intercept and compete with that function. And if you get rid of those heavy metals, a lot of function returns, especially neurologic function. And so that's what they saw. Now, they have always been looking for better and better chelation therapy. And what we've seen, when we think of chelation, we usually think of things like EDTA. So the first issue is it's IV. So it's a needle and you got to sit there and go through an IV process. That's the first thing. The second thing is it's non-specific. Chelators tend to be specific by charge. So EDTA has a -2 charge. It takes out everything with a +2 charge. That includes lead, but also includes calcium, magnesium. So when you're chelating with EDTA, the practitioner is adding calcium, magnesium back into you to make up for the difference. And what happens is you never get all of the, you can't get the lead out because by concentration, you're removing so much calcium, magnesium, you keep adding back into the patient. So you'll never get all of that heavy metal out. So that's a problem. When it's charge specific, you're never going to be able to get all the heavy metals out. And there are different chelators that can remove mercury and cadmium based on charge. But the problem is there's lots of good things that have that same charge. And then lastly, the doses required for EDTA are very high, the multi-gram quantity. So it's very hard on the kidneys and the bladder. So if you have kidney or bladder problems, you cannot do that sort of chelation therapy. And so, of course, since then, there have been a lot of oral chelators and catheterators that have come to market, but they all have the same issues. They're hard on the kidneys and the bladder. They can be hard on the digestive tract, and they're not specific. They take out the good with the bad. And so when I saw what clinoptilate could do, that because of the size of the pores and the net charge across the surface of the zeolite, that it actually loves small, highly charged metals and does not like bigger, lower charged metals, it became this perfect molecular sieve to pull out the bad stuff and leave the good stuff. And had been used like that for hundreds of years. And so it's oral, it's a micro dose. You're talking about micrograms and milligrams to do the same thing of multiple grams of EDTA. It's easy to take, it's easy to pass. And you see almost immediate results with these kids as they get rid of these toxins and heavy metals and see a return to function.
It's awesome. And we have a question about the plus relief over there. I'm going to let you read it from Rosemary. Also, I love the fact about the Plus Relief, Marcy discovering that if we put 5 sprays on our mouth before we go to sleep, we get better sleep. Maybe you could comment on that also.
Okay, so here, start using for hip stiffness, most sensitivity. Oh, heat sensitivity disappeared. Is it possible to reduce or limit damage having been done in multiple named conditions? Well, okay, so I don't know if we're just talking about Plus Relief or we're talking about Cell Defender, but the way Plus Relief works, I've talked about this before. The cobra venom in the Plus Relief has a compound in it, a protein called alpha toxin. An alpha toxin binds to a very specific receptor. It's the alpha 7 subtype of the nicotinic acetylcholine receptor. That receptor is on the central nervous system. There's the central nervous system, but it's also on the surface of white blood cells. So in the central nervous system, what it does is it modulates the signal that goes through the nerve. Big signals get truncated. So big signals become little signals. That's pain, goes away. Heat sensitivity, that's a big signal. So it's going to modulate and turn the dial down of those signals. And for those of you who've used Plus Relief, you can understand what I'm talking about because it's a very interesting feeling. Like I have chronic back pain. I have a syringomyelia in my back, a syrinx. It's like a gap in my spine. And I have chronic pain because of it. So for many years, I simply was popping all sorts of over-the-counter pills. I took acetaminophen, acetylsalicylic acid, ibuprofen, naproxen, and I would take those over-the-counter drugs in a way that would minimize the side effects because I understand dosing and side effects. I never used opiates because I think for a living. I didn't want to screw up the way I think. So I just took high dose of those over-the-counter drugs. And I did that for years until I made my first cobra venom product in 2009. And then since then, that's all I have had to use, and I'm pain free. There's orthopedists that can't believe that I have a large syrinx in my back and I'm functioning and I'm running around. You guys saw me dancing at the conference, right? I can function pretty well for someone with a gap in my spine, you know. But when I use the Plus Relief, I know there's a problem. I can still pinpoint it. I can feel it. I can point exactly where it is in my back. It's not a numbing agent. It doesn't mask the pain. It turns the dial down so you can function. Okay. And that's important because a lot of people that take numbing agents, they re-injure their problem because they think, and I always think back to high school. I was friends with a guy named Mike Diamondstein, and he sprained his ankle, and we went to a school dance, and he was on Percocet. And he's dancing in the dance. I'm like, are you nuts? You have a bad ankle. Goes, I feel fine. I feel fine. The next morning, he actually was laid up after that for about 6 weeks because his ankle, his foot swelled up like a football. He was in so much pain. It was ridiculous. But that's because he masked the pain, and so he re-injured the issue. He continued to injure himself. That doesn't happen with the Plus Relief because you still know there's an issue. You can make sure that you don't re-injure yourself. But we've seen other things happen with that because it is anti-inflammatory as well. It's not just stopping the pain; it stops inflammation as well. So you can really see that. So you talked about the teeth sensitivity going away. Let's see, heavy metal toxicity. So, I mean, yeah, so obviously you want to be on the Cell Defender for things like mercury and uranium poisoning and things like that. And yes, if your issues are caused or worsened by inflammation, over time, the inflammation is going to reduce that. And I've talked about this before. One of our investors at Nutripharma, he talked about the fact that he had chronic pain. He was in his late 60s and he had arthritis, and he was taking our product to treat arthritis. But he calls me crying because when he was 9 years old, he got hit in the face with a baseball and it shattered his orbital and his cheek. And he has a piece of metal, he's a metal plate in his face, and he has not felt his right cheek since he was 9 years old. And he's using our product for pain, but suddenly he could feel his cheek for the first time since he was 9 years old. And I believe what was happening is that the nerves, because it was modulating the signal through the nerve, the signal got small enough that it could go through now, and he could start feeling that. He started getting that sensitivity again. So it was something that we weren't looking for, but he couldn't believe it. as a side effect of treating his pain, he actually got feeling back in his cheek. So that was really, really interesting. Someone before asked about if I was part of BIOS Life at Rexall. Understand that when I got there, we had BIOS Life 2. And I did work with Dr. Charles Day, who was the inventor of BIOS Life. He's written several books. He must be passed on by now. His son actually has a company called Sheltui Pharmaceuticals out of Kentucky, and they do some really, really good work. But I did work with BIOS Life, and I worked with some of their other fibers. Someone's asking about the salmon we're using for the cat products. We are actually not using salmon for the cat products. I know I said that at the conference. I couldn't get a good standardized cat salmon flavor. So we're actually using tuna. It's natural standardized tuna oil suspension. So all the cat products are going to be tuna flavored to start. Okay. And yes, it's natural wild caught tuna, extracted oils from the tuna. So let's see, someone said, okay, we already took that. Was you saw me dancing with my wife? Yes. That's actually a contract I have with my wife. Anywhere there is dancing, I have to dance with her. So I'm prepared, weddings, bar mitzvahs, whatever. So the fact that Neil subjected me to that because he had live music, I had to dance with my wife. So
And you love to dance and you enjoyed every minute.
yes.
Let me fix that for you guys. Yeah. Rick, also, they were talking about the sensitivity of teeth. And one of the things that we found is we have so many people who are hygienists, dental hygienists and stuff, and work with people with their teeth. When we first started using the Cell Defender, and many of you since have been telling me that you've experienced this, that going to the dentist instead of not digging the tartar off, that the buildup on the teeth is so much easier to take off. And that's one of our little side benefits of our product. It's something that our dentists that we've worked with in the past have shared with us, that using the Cell Defender actually changes how stuck I'm not saying it very scientifically, am I? But
Yeah, no, I understand the plaque formation.
The
is
plaque
not
formation
as solid.
is easier to
That's kind of
remove.
interesting. And
Mhm.
my wife and I both use the Cell Defender with our toothpaste. So we actually put a couple of drops when we brush our teeth. And you noticed that too. You said it helped whiten teeth and things like that. And yeah, certainly it's perfectly safe to use in that fashion. Yeah, it's interesting. Now, we also did studies with the Plus Relief at Nova Southeastern School of Dentistry, where they used the cobra venom. They used the Plus Relief product before and after oral surgery. And they found that if they used it both before and after oral surgery, they had less pain, less inflammation, better outcomes from oral surgery. They also did a small study in TMJ, where you have the clicking in the jaw, and they found that when you rub the gel here, the TMJ goes away. So we have that from the Nova Southeastern School of Dentistry.
Mhm.
Very cool stuff.
Couple of
Someone's
things.
asking about.
I was going to ask a couple things. Go back on the Plus Relief. Marcy's kind of helped us all discover, and she's gotten better sleep, of course, amazingly, with spraying 5 sprays in our mouth before we go to bed. Can you comment on that for us?
It's pain and inflammation, so especially if you have any kind of inflammation, it's going to interrupt your sleep. But yeah, all of us live. If you get as old as us, you're going to have some sort of pain and inflammation. Okay, so I say that a little tongue in cheek. I'm 55 years old, but I feel every second of it, especially the 14-hour days I've been putting in here. So. But yes, you can certainly use it before bed. It is not stored. These are peptides, so nothing is stored. But because of the way it works faster and longer and better over time. So you'll need less and less and less over time. So for example, when I first started using it, I took 5 sprays 5-6 times a day. Now I take a couple sprays in the morning, a couple sprays at night, and I'm pain-free all day and night. And it certainly does help. When I talk about stage 2 and stage 3 pain, that's what they call the World Health Organization 3-step pain ladder. Stage 1 pain is from 0 to 4, and that's just annoying pain. That's pain that usually take an aspirin, take a Tylenol. Stage 2 pain from 4 to 7 on a 10-point scale is identified as pain that interrupts your sleep and or your work. So if the pain is interrupting your sleep, that is by definition stage 2 pain. And then stage 3 pain from 7 to 10 is considered intractable pain. That's when you actually have to be medicated to deal with the pain, or you can't function, you know? So yeah, so our Avini plus relief is actually the levels of cobra venom are validated for stage 3 pain, stuff that normally you would take opiates to treat.
So I know we're keeping you on a little longer than we planned, but everybody kind of got a late start. There's several new messages. I'm gonna let you go on through those, and then we're gonna go ahead and let you go back to work.
So the next one says, someone asked about ALS, Lou Gehrig's disease, and it's heartbreaking. So what causes Lou Gehrig's disease? No one knows what actually triggers it, but the actual etiology is oxidative stress. Free radicals build up in the nerves and start to destroy the nerves. And so most of the treatment for ALS is using antioxidants. I'm saying this because I've actually studied my multiple sclerosis drug in Lou Gehrig's disease, and patients subjectively said they felt better, but they didn't get better objectively. And I was telling someone this story about a year and a half ago, saying that I think what was happening is our drug was binding to the nerves and improving nerve function, but because it wasn't an antioxidant, it wasn't doing anything about the disease itself. It's a shame that my drug isn't also an antioxidant, to which I had an aha moment and said, why not? And so we did file a new patent about a year ago for the treatment of Lou Gehrig's disease, where we're attaching a powerful antioxidant to our existing drug that we use for treating MS, to the point that our drug should bind at the nerve site of the neuronal junction and dose an antioxidant right there where it's necessary. On the computer, it seems to be the treatment for ALS. It seems to stop it in its tracks when we model it. So we are making that drug. We expect to do a rabbit model sometime over the summer. And if it's successful in the rabbit model, that could be the next drug for treating Lou Gehrig's disease. As it is for Lou Gehrig's disease, I do recommend very high dose antioxidants, at least 100 milligrams a day of CoQ10, a nice antioxidant formula with A, C, and E in it. That is the way to deal with ALS. Additionally, you have to keep lean muscle mass. So make sure they're using a protein powder that's very high in branched chain amino acids. That'll help try to maintain lean muscle mass. And then, of course, Cell Defender. Our fiber is fabulous if they can still eat and they still can use still digest. So all regular nutrition as well. But it is heartbreaking when you see an ALS patient. You become your mind is still sharp. Look at Stephen Hawking. He was one of the most brilliant people in the world, a prisoner in his body because of Lou Gehrig's disease. You know. So someone says my dog will love the fish. Yes. So the dog and the cat products are exactly the same except for the flavor, basically. So they're really formulated to something that specifically a cat would like and a dog would like. But if your dog likes fish, it's going to like the cat product.
And Rick, while you're on that subject, would you just tell just a sec? I know you've told, but now's a good place too. The very fact that we have a product for cats for pain, just hit that for just a second.
Yeah. So years ago, I wanted to launch, and we did launch products using cobra venom to treat pain in animals, because when we have pain and we go to the store, there's literally hundreds of choices of products for us. There's all sorts of over-the-counter, topical, and oral, and stuff you put in your bath, and there's all sorts of things that humans can take for pain. We don't have those choices for our furry friends, for the animals. In dogs, for example, most of the time, if your dog is in severe pain, they're going to give them an opiate, tramadol or Demerol, or they'll give them Neurontin, which is gabapentin. which is also addictive, but it just makes them sleepy and it's addictive and has all sorts of other side effects. Or they can give them NSAIDs, non-steroidal anti-inflammatory drugs, which cause all sorts of digestive issues in dogs, good diarrhea, constipation, all sorts of those issues. So there's really nothing safe that you can give a dog that really works. And then for a cat, every single pain medication causes kidney failure in cats,
Right.
and that's known. Cats have very sensitive kidneys. And even if a cat has surgery, they'll send you home with a micro dose of pain drugs that you're supposed to use sparingly, because every pain medication causes kidney failure in cats until our stuff. Our stuff is perfectly safe, is naturally effective for pain and inflammation, and works amazingly well in dogs and cats. And we've seen this now because our other pain product for animals we've had out there. We have over 500 positive reviews on Amazon. We know it works, and we're just decided we're going to make a more specific chewable treat for Avini at a higher dose, so it's going to be that much more effective.
I love it. Thank you so much. I
My
think,
pleasure.
guys, if you didn't understand, what he just gave you is a marketplace for your product that absolutely exists everywhere. It doesn't matter where you live. It doesn't matter who you know. It matters that that product is unique in all of the world, but certainly in your world. So take it to the bank.
And someone asked when that will be available. I know, and Annette has her hand up too, Rick, and there's several things on there that actually, Mark, if you want to give your testimony next week would be wonderful, please.
So I really wanted the pet products out by now, but we just got so swamped fixing the debacle that was Trim Science. That was not our fault. I know the buck stops here. Me and Neil have to take responsibility for everything, but we made the mistake of trusting a third party. Okay, so it's not going to happen again. But it was a Herculean task to take those products in, order 40 raw materials, because you got to look at what's in these products. It's 40 raw materials, packaging, labels. We had to hire people. Me and Neil, we interview people today. We keep hiring people because we got to keep growing to keep everything going. So it was our Herculean task to get where we are with the Trim Science. So now we're finally kind of caught up. I didn't want to make too many commitments. I would like to say the pet products will be available next week. I'm going to do everything I can to make that happen, but I don't want to make that promise. Okay. But we will let you know the second they're available to make sure that you guys can get those products, because they're going to be valuable products for us. They're going to be amazing, and they're going to generate immediate testimonials. I saw a woman here. I see behind her like a mandolin and a violin, and she was playing with a really cute dog. So I know there's dogs out there. And then earlier, I saw someone had a picture. Was it Darren Sliva with a little like a little Chihuahua or a little terrier? So I know we love our animals. I have 2 dogs. I'm really much of a dog person. Not a great cat person. I've said this before, but certainly we're going to make a great product for cats, for the cat people out there.
Right.
And we're going to
And
make
for
it
the
available
lady
as
who
soon as
asked
possible.
about water, in water or not in water, please understand, most of us use it right use the Cell Defender directly in our mouth. It's just because we don't want to leave one drop in the jar or in the glass. It's perfectly effective to use it directly.
Yeah, let me talk about that, because that was one of the findings of the coal miner study. So we did a study in coal miners because we knew that they were a highly toxic group of guys. And this was a double-blind, placebo-controlled study, so no one knew if they were getting placebo or active. But we told them that we want you to take the drops, we want to take the zeolite, and how much to take. We didn't care how they took it, but we wanted them to be consistent in the way they took it and tell us how they took it. And so we measured as much as a 15-fold increase in heavy metal excretion, and the coal miners used the product, and it didn't matter how they took it. Some people put it right in their mouth. Some people put it in their drink. There was a guy that put it in his mashed potatoes every night. He was a meat and potato guy. There's another guy that had a glass of scotch every night, put it in his speech every night. It didn't matter how they took it. As long as it got in their body, they had the same benefit. So this is valuable information. Get it in your body. Put it in your food, put it in your drink. If you have a friend who won't take it, put it in their food, put it in their drinks, because just get it in your body to be able to get that benefit. So that was a valuable little piece of information we got out of that study.
I want to take Annette's question and Rick, if you have time for the other couple, but we're going to have to stop here and let Rick and Neil go back to work here pretty quick. Annette, do you want to unmute real quick and ask your question?
Sure. Hi. My name's Annetta, and I'm a cat person, by the way, so I'm really excited about the cat. So anyway, what I wanted to ask, I have a lot of friends that have diabetes, and you have mentioned it, and I'm new to this. I just wanted to understand a little bit about how the products work and how you recommend them for people with diabetes, type 2.
Okay, so yeah, my principal recommendations for anyone with blood sugar issues, glucose insensitivity or insulin insensitivity are the Cell Defender and the fiber primarily. The Cell Defender, first of all, everything works better when you're taking the Zeolite. All metabolic processes are improved. But something we saw early on with diabetics is they seem to have a little better insulin utilization and a little less side effects from their diabetes. As I mentioned before, we talked about the guy with diabetic retinopathy. And at first, we didn't really understand the mechanism, but we found out over time blood sugar, glucose, is too big to be absorbed by the zeolite. But glucose has a slight positive charge. It has something called a dipole moment, where part of the molecule is positively charged and part of the molecule is negatively charged. And what we think is happening is that the zeolite itself has become a shuttling mechanism, where the zeolite is going around the body, flying around the blood and the lymph, and because of the strong negative charge, it's pulling the glucose along with it. It's not trapping the glucose, it's not eliminating the glucose, but it's keeping it in circulation. And when you think about diabetes, the danger of diabetes is not too much sugar, it's that the sugar starts to attach to things. It starts hanging out around the blood vessels, attaching to the blood vessels, causing claudications. It hangs around the nerves, causing glycation or glycosylation of the nerves, causing diabetic neuropathy. It hangs around the back of the eye, causing diabetic retinopathy. And so when the sugar is hanging out of places, it causes the side effects or complication of diabetes. So if the zeolite is able to keep it in circulation, it can allow you to better utilize that blood sugar over time, and it prevents it from attaching to things, causing those complications. So that's the zeolite's mechanism. Then you have the fiber. The fiber delays gastric emptying because of its soluble fiber gel matrix. So what happens when you eat your meal, if you take the fiber about 10 to 15 minutes before you eat, your food will go into the digestive tract at the same time as the fiber, and the fiber will trap your food and it'll delay gastric emptying. Your food will be absorbed more slowly over a longer period of time. And that's called preventing postprandial hyperglycemia, that blood sugar spike you get right after meals. And we have clinical evidence. We did a study with the Cleveland Clinic, and we showed that right after meals, instead of having the spike in blood sugar, you have this nice little stable curve where it's stabilized. So you never have that spike and this crash in blood sugar levels, which is very, very healthy for a diabetic. In fact, I tell people, if you're approaching a diabetic with Avini, have them use the fiber before dinner. Their very first dose should be before dinner, because the very next morning when they check their fasting blood sugar, it's going to be lower. So it gives them an immediate belief in the products. Okay, so it turns them into a believer overnight, literally overnight, because they're going to see lower blood sugar the very next day because they used the fiber before dinner. Okay, so those are principal things. And of course, everything else helps. The immunity helps, and the plus relief. Certainly, the plus relief helps if they have neuropathy. It's one of the greatest things for neuropathy. You can use the gel, topical gel, if they have neuropathy in their feet, or the oral spray. So it certainly helps for those issues with diabetics as well.
Okay, yeah, because most people I'm thinking of also have inflammation. And I can also attest that my one friend that has severe diabetes, he did use the fiber product, and it did exactly what you're saying. And it made a huge difference in his digestion period, but also his blood sugar levels leveled way, it was just much better.
Right.
So,
yeah.
yeah.
Darren had a great testimony. Darren's HbA, and that's the thing too. Every 3 months, you should check your HbA1c. For people that don't know, hemoglobin A1C is an average measure of your blood sugar levels over a 3-month period because it turns over every 3 months. So I always recommend getting it checked and then use the fiber for 3 months and get it checked again. You're going to see a plummeting HbA1c if you use the fiber regularly.
Okay,
And
thank you.
Rick, thank you, Annette. Sorry, I said your name wrong earlier. That's beautiful. Thank you, Rick, so much. We don't want to, we want you back. And so we want to let you go so we don't get in trouble here. Thank you so much for being with us. And if your questions didn't get answered, guys, you can text them in to Neil or Rick or the Inner Circle, and he'll answer those for you too. We do want to thank you so much for taking your time, Neil and Rick both. And Rick, we can't even understand what you guys are going through right now for us. We just want to say thank you. And so Howard, if you go ahead and just close the call off, I'll let everybody say thank you in person if they'd like before we let him go.